Okay, so we're going to do the suicide intervention. Phil's volunteered. He's done years and years of therapy, he's training to be a trainer, so we're going to use him as a model to go through the demonstration of the process. HMS Therapy then, why do we need to learn HMS Therapy? Through doing your practitioner training, using HMS Therapy is another tool in your vast amount of tool bag that you're using to work with a client to get the best result with an emotional problem and something as drastic as suicide. If that is a program they're running, then you can use this intervention to help them overcome the emotional connection to suicide. What is suicide? The prevention intervention script is designed to work with the emotional feelings that go with someone who's feeling suicidal and to help them overcome them. So there's 3 phases to HMS Therapy and how it works, and we're going to be talking through today with all of the different interventions I've got. They all have 3 phases, and the first thing you need to do before you work in the context of suicide is obviously establish a relationship with your client. So you have to make sure safety, trust are the 2 paramount sort of before you begin doing this intervention, and also you've got empathy with your client to sort of have an understanding of what the client's going through and feel empathic towards that person you're working with. Once you've established that relationship, and then you need to identify the gestalt. Now you can use meta model question techniques, but if someone's running suicide, it's pretty prevalent when they come to you that they're going to be running those negative emotions connected with suicide, which is quite a hard sort of topic to work with. So phase 1 then is what we call the induction, the inception, the start of the therapy. And the suicidal prevention intervention is on page 9, and it does say for master practitioners only, but as a practitioner, if you believe that you can work with somebody and it's a life or death situation, and as long as you've got your public liability insurance and you ring me up, or if for instance one of the trainers has trained a practitioner and they feel that they feel that it's within their capability, then I say go ahead. It's going to be on your head as a practitioner. As long as you've got your public liability insurance and you've contacted your trainer to tell them that you're about to work in that context, then go ahead and do it. Because if it's going to save a life, then then sue me. That's the way I look at it. So the first thing with the HMS Therapy, the way that the intervention is designed is phase 1 is the induction, and we're using a meta model technique to get into the root cause of the problem. Phase 2 is the transformation, what I call is like the meat of the therapy, the 2 bonds that sort of hold the meat together is like the entry into the therapy. The actual change work is the transformation bit, which is phase 2, which is where we get to the root cause, the heart of the problem. The gestalt change is where we're going to change the gestalt. So we're going to try and recover lost information, lost emotional intelligence from the past, and to completely change the perception, the emotional perception to that horrible feeling. Because it's the suicide intervention, there is a slight difference to the other parts of HMS Therapy, is where we introduce a negative anchor to stop that person from committing suicide. And when I go through the script in a minute, I'll show you where that specifically is in the therapy. Phase 3 is the integration phase. The integration phase is the anchoring. It's the Milton model then. Once we've anchored the positive resources and then the new emotional intelligence that gives a different perception to the problem, we're then going to use Milton model to chunk back up to the here and now and test those resources. So the phase 3 is the integration bit. It can be almost confusing for the person you're working with. It's like they don't have those emotional connections to that problem. If they still do, you go back in and you go through the whole script again. I've never had to go back in twice with working with a client. The way that HMS is designed is literally it weeds out that problem there and then. But if you have to go over a gestalt again, then you go over a gestalt again, and you keep shaving off what I call layers of the onion until you get to that core sweet bit in the middle, which is the sort of the person's. People like to think of like HMS Therapy changing someone. You're going back to the best version of yourself, which is inside here in your heart, how you should be, what it is you want to achieve, and that's what HMS allows you to do. It's a vehicle for allowing you to get back to who you really are, becoming a best version of yourself. So we're going to go through the suicide intervention now. So first of all, you just go through the motions on this. I know you've been and done therapy before, but we just want to sort of go through the process. Is it okay to do this first?
Yep.
Yeah, cool. So if you just allow your eyes to close. So I'm obviously getting myself in position. We've got rapport already, so we can now go into. So, have you ever felt suicidal before? Are you prepared to let go and overcome these suicidal feelings in the context of suicide? Can you feel the suicidal feelings inside your body? Where do you specifically feel them in your body? Brilliant. Remember, you're totally safe and you're totally in control at all times. Remember, you're totally safe and you're totally in control at all times. If you notice, my tones now are just dropping down, and the more that you can be hypnotic, the more your tones can be hypnotic, the better result you'll get with your client. Is it okay now to trust your heart, your mind and your soul today to facilitate a drop down through your existence, the specific negative emotions that will never come will allow you to move on from the situation? Good. What is the negative colour associated with the suicide?
Black.
Brilliant. I want you to drop down through your heart now to the most toughest, challenging feeling of that suicide. Are you there right now? We're now into phase 2 now, the transformational bit. What is the negative colour that is there? Negative word, negative sensation, negative person, negative feeling that is there. Have you got it? That's right. Drop below that. What's below that?
Fighting.
Drop through the fighting. What's beneath the fighting?
Sky.
Drop beneath that. What's beneath that? Family. Brilliant. So we've got 2 positives now. We had sky and then we have family. So we've got down into the sort of the sort of if you like, the centre of his emotional intelligence within his heart. And what we're going to do now is we're going to just ensure that is there any negative colours in there connected to suicide? Drop beneath that. What's beneath that? So we're going back in now to a negative colour. What's beneath that? What's beneath that?
Fighting.
Drop more fighting. Go through all of those.
Yeah, a bird, me being a bird. Some big wings.
Is that positive? Is that positive?
Like an eagle.
So what's happened to suicide? What's happened to the feelings of suicide connected to your existence?
Yeah, there isn't.
That's right, there isn't. So now check those suicidal feelings. What's happened to them?
I can just see the bird.
That's right, you can just see the bird. That's right. So what or who in your life would stop you contemplating suicide again?
Children.
So we're installing the anchor now to prevent him from doing it or from thinking of this again. Children, that's right, children. I want you to see an image of those you truly love stood over your dead body. What would your death do to them?
They'd be devastated.
That's right, they would be devastated. So feeding back, we're anchoring now him to stop him from doing this ever. How would they feel?
Broken.
That's right, broken. And what would be the outcome?
You never get to see them again.
That's right. You never get to see them again. I want you to see an image of your new future where you choose to live. What does that look like?
At the beach.
So we're anchoring now the positive resource now. What does that feel like?
Free.
free. Step into the future now and look back at the image of your suicide. Is that an option anymore? And you need to be looking at his head for this. Is that an option anymore? No, so the shift happened then. Step into the future. What are the positive emotions, positive pictures, positive sounds, positive sensations and positive people that have replaced the negative image of suicide right now?
Just enjoying being with my family.
Just enjoying being with your family. And what will this do for you? So we're anchoring now again the positive resource to override the negative feelings and the negative past of suicide. What will this do for you?
Keep me a happy life.
Keep you a happy life. How will that serve you?
Just be happy.
Just be happy. What does that look like? What does that feel like?
Feels great.
Well done for changing what needed to be changed and place all of those positive colours into every situation that reminds you. Is there any negative feelings connected to you? Good. And now you've finished, you can gently open your eyes. If you were to see, now we're going to do the test now, which is phase 3, the integrate. We've done the integration phase by chunking them back up. We're going to test the resources now, which is also part of it. If you were to see, hear or feel suicidal again, notice how different it looks now. How does it look?
Horrible.
How does it feel?
Horrible.
Is it an option anymore?
Mm-mm.
Can you imagine committing suicide in the future with these new feelings and belief from now on? So how has it changed? What has changed?
I can never do that.
No.
No.
And he's congruent with that. He's saying, I couldn't ever do that. If he was saying, I couldn't ever do that, and his head was doing that, I would put him back in and keep going until we got that congruency. Does that make sense? Yeah?
Mm.
Cool. So you were congruent with what you were saying then. So see how the well done. So what we did then, we did the phase 1, the induction, using the meta model to chunk down into that was connected to some family members. We used then what we did, phase 2 was the transformation, where we found the root cause, heart of the problem, and then it turned into like a bird, which was pretty out there, pretty vague, but it was pretty important for him, whatever that meant to him. So we changed the gestalt. So the gestalt went from suicide to, then once we connected with that, once we found the emotional resources, we then locked them in, we anchored them, and we anchored them again by, and then we gave him, we introduced a negative anchor, which was, what would your suicide do? So we basically gave him the contemplation, what would the life would be like without him in it, which is what I call the It's a Wonderful Life moment, which if you've seen that film, it's almost like you're being given a flash of what the world would be like without you in it. Does that make sense? So we're showing you what the world would be, so you're giving that person that whole, well, you know, the repercussions of your death would have on other people. And by showing them that, it's like, I can't die, I can't give up, I've got to keep going, I'm a dad, and then anchoring that positive resource and giving them that sort of choice to sort of choose their future over their death. And then what we're doing is we're using the Milton model to keep anchoring them, but also bringing them back into the here and now, bringing all that new image of their future, and also what they're going to miss out on if they do terminate their own life. So we're basically going back into that root cause, and we're giving them a chance to experience what life would be like without them in it, and it's just not an option, is it? No. So that's how it works. Any questions from you?